Dr. Robert Lelouch, a board-certified OBGYN physician with over 30 years of clinical experience. And today we're going to talk about pain with ovulation, or its medical term, Mittelschmerz, which is German for middle pain, meaning pain in the middle of your cycle. It's pretty common, and in some women it can be quite uncomfortable. In fact, probably once or twice a month we have a patient who comes into the emergency room with just that diagnosis. So what is it? What's it about? Well, once you become fertile, you start having a menstrual cycle. Every month, your ovary makes a cyst, one or the other. That cyst grows bigger and bigger, and then it pops, and out comes the egg. And that's called ovulation. And approximately 2 weeks later, from when that worst pain is when your period comes. So women can have periods that vary from 4 weeks, give or take 7-10 days. However, what's pretty fixed in time is from that point of ovulation, 2 weeks later is when your period comes. So if you're curious if you're having that pain, you can backtrack. So you look at when your period, the first day of your period, look back 2 weeks. And if you've written down when you had the discomfort or pain, you can see, oh yeah, that's what it was. So for some women, it can be a gradually increasing ache over a week that peaks into a sharp pain and then gradually goes away. So the whole process can be 5-7 days, but usually only just a few seconds of intense, sharp stabbing pain. If you know about it, you can be a little less concerned about it. Some women don't have a lot of discomfort, others have serious discomfort. We frequently give the birth control pill to help with that discomfort. If you're someone who has that, even if you're not sexually active, but you have that once a month, we have lots of teenagers who have lots of discomfort with their periods and also pain with ovulation. And the birth control pill suppresses that. It suppresses your hormones, it takes over for your hormones, and it stops the ovulation, and so takes away that pain. It can be quite effective. Also, if you've been on the birth control pill for a while, and then you get off the pill, then your brain notices there are no hormones around and sends a message to your ovaries. Come on, we need to see some hormones. And so you can get a bigger surge because the ovaries have been sleeping, get a bigger cyst, a bigger ovulation, more pain, slight increased chance of getting pregnant if you're trying to get pregnant. But that's a common time where we see patients in the emergency room. They've been on the pill for years, they decide to get off. The first ovulation afterwards can be quite uncomfortable, pretty scary if you don't know what it is, and we see them in the hospital. So now that you know what it is, you can potentially avoid a visit if it's matching your dates, and be sure you drink fluids, take an Advil, ibuprofen. But remember, if you're in severe pain, it's not following that pattern, you need to seek help. So I hope you have found this helpful, and now you know that one of the main interventions for it is the birth control pill. There are other things that can be done, but that's primarily what the main cause is. There are other causes of pain that might be in mid-cycle. We have another video on endometriosis. You could have adhesions, you could have an infection, you have intestinal problems. But if you see this pattern of having pain and 2 weeks later you've got your period, then you can pretty much bet that it's ovulation pain, Mittelschmerz. So please leave your comments. Thank you.